Dr. Matthew Woolard recently received a 4-year, $1.45 million grant from the NIH Heart, Lung, and Blood Institute to study macrophages and atherosclerosis.
Atherosclerosis is the hardening of the arteries. What we really hear about is the old good cholesterol versus bad cholesterol. And so eventually what that causes, the bad cholesterol, is a process called atherosclerosis where the arteries harden. And eventually that leads to heart attacks and strokes and peripheral artery disease, all the bad things we think about with heart disease. The problem is it's not just a cholesterol-mediated disease, there's an immune component with it. And most importantly, there's a cell called a macrophage. And what macrophages like to do is they like to eat things. And normally what they do is they come in and eat the bad cholesterol to get rid of it out of your arteries. But for some reasons, those macrophages, as they're eating that bad cholesterol, all of a sudden decide this is a pathogen, and we need to respond as if it's a pathogen. And then we get this inflammatory response in the arteries that really drives all of atherosclerosis, resulting in the heart attacks and stroke. And so what we want to understand is, why do those macrophages begin to think of cholesterol as a pathogen and respond as such? And so the current grant application we have is actually understanding that as macrophages process the cholesterol and store it, they turn on a pathway called the glycerolipid synthesis pathway. It's a fancy name for making lipids. And there's one enzyme in there called lipin-1 that seems to be really important in storing the cholesterol. But we also found that as it's storing the cholesterol, it makes the macrophage angry, so to speak, and that's why they become pathogenic, or at least partially why they become pathogenic. And so we're trying to understand what lipin-1 is really doing, how it's contributing to the macrophage inflammatory response during atherosclerosis. And our hope is if we can understand why macrophages become inflammatory during atherosclerosis, we can prevent that. And that might actually be a great way, in combination with statin therapy, to better prevent heart disease than currently what we're doing.